this will serve as our first lecture as we actually start discussing about diagnosis of pregnancy. So diagnosis of pregnancy is just, every issue all around. You are trying to confirm that a woman is pregnant. Okay, you are trying to confirm. Now, confirming that a woman is pregnant can start from just having some little ideas, towards it, to going to the lab to do a lot of tests, to doing all those imaging, all those ultrasound to now look at the baby, feel the baby heartbeat up till down. Do you understand? So let's have an introduction to this concept before we move further, which I think I have like over 21 videos under this topic, all right, in obstetrics. So what we have, just so you know, is a foundational aspect of obstetric care, right? So it's blending clinical observation with modern diagnostic tool. So from the ideas of this woman being pregnant to you confirming it in the lab by doing human coronary gonadotropin test, you are still going to all those ultrasound, okay, to confirm all. So diagnosis, you are trying to identify physiological changes, hormonal changes that usually occur because a woman is pregnant. Now you should note that some of these hormonal changes can also occur in some other disease states. Do you understand? That's why the only definitive test for confirming that a woman is pregnant is the ultrasound. So you want to actually combine clinical signs, the results you got from your lab test, all right, and also results you got from imagings. So if you sum everything up, you should be able to confirm that an embryo exists. So key diagnostic approaches. First of all, you actually ask the woman, when last did you see your menstruation? That's the first question, right? So so you want to dictate that maybe she has missed her period. Of course, that should be the first thing that will point you to start suspecting that the woman is pregnant. Okay, or is something that could actually even help you to like calculate the gestation, like the expected delivery date. So early symptoms may include nausea, vomiting, and breast tenderness. We're trying to ask her all of this, okay, to see if she has any one of them. Then on physical examination, you try to pick up some signs, all those Chadwick, Hegars, and the rest of them. Ultrasound remains the only definitive. Okay, so laboratory evaluation, you check for human coronary gonadotropin. Okay, so ultrasound, so a transvaginal ultrasound, this is transabdominal. So transvaginal or transabdominal can be used, So you also watch out for all these signs and symptoms depending on what the trimester. So first trimester, those are the common signs and symptoms. Second trimester, those are the common signs and symptoms. Third trimester, those are the common signs and symptoms you might see. So not all symptoms will 100% confirm that there is a baby. I've explained that over and over again. So some signs will only give you an idea to move further. If a woman told me that she missed her period, I will only move further by doing a pregnancy test. Do you understand? After I do a pregnancy test, I will only move further, okay, by doing an ultrasound to further confirm. So that's just what this introduction simply has for us.